again. My name is Sakina Alston, and I am a Master's of Nursing student at ECPI University, and I'm completing a Week 3 XP assignment for Nursing 531 for Martha Colvin. We were required to find a healthcare policy or act or program and see how it affects our healthcare, a health promotion, a population health problem, and see if it promotes health promotion. So I'm going to just start to talk about mine. So the Ryan White HIV/AIDS program is an emergency resource initiated by Congress in 1990 with the intent of decreasing HIV/AIDS disparities noticed in people who are poor, uninsured, have limited access to healthcare, and non-white. It was first given the nomenclature, the Ryan White Comprehensive AIDS Resource Emergency Act, or the CARE Act. Since then, the act has been reauthorized and renamed in 1996, 2000, 2006, and most recently in 2009. In 2009, it was reauthorized as the Ryan White HIV/AIDS Treatment Extension Act of 2009. The program is divided into parts A, B, C, D, and F. Part A provides funding for eligible metropolitan areas. In order to be eligible, the area must report more than 2,000 new HIV cases in the past 5 years and have a population of at least 50,000. Approximately $655.9 million in funds was allocated to this part in 2014. Part B provides grants to improve the quality, availability, and organization of HIV/AIDS programs and services. To be eligible for this part, areas must report at least 500 new HIV/AIDS cases in recent years. The funds are allocated to antiretroviral drugs. The most funds from the Ryan White Fund CARE Act are spent here at an approximate rate of $1.32 billion in a fiscal year of 2014. Part C allocates money to outpatient services and spent $201.1 million in 2014. Part D covers family-centered care. Part F is dedicated to research, technical assistance, and access to care programs. It provides access to those who are hard to reach by funding innovative and technological strategies, outreach strategies. $25 million is allocated to this cause annually. A sum of $33.6 million was allocated to educating HIV and AIDS healthcare providers in the Part F AIDS education and training centers portion. The population in North Carolina is 9,535,483, according to the 2010 census. County populations range from approximately 4,000 to almost 100,000 each. 18% of the population lives in 16 counties, including Pitt County. The state and several counties in it meet the population requirements for funding from the CARE Act. HIV in North Carolina affects ethnic minorities disproportionately. Access to HIV programs is a known barrier in many counties in NC. In 2012, NC ranked 10th out of all states for the new HIV infection diagnosis. In 2012 alone, NC reported 1,389 new HIV diagnoses. In 2012, the estimated number of new HIV cases per 100,000 in North Carolina is 1,740, with a 5% confidence interval. With the population size of over 9 million, it is safe to say that the most counties in North Carolina meet the new infection rate requirements for funding from the CARE Act. The CARE Act is beneficial to the HIV public health promotion in NC and specifically Pitt County because it will provide funding to address many of the areas of deficit, such as education of healthcare providers, barriers to healthcare access, focus on decreasing health inequities of racial ethnic groups, funding for HIV drugs, and much more. The funds allocated to technical advances and efforts to provide healthcare access to more people is of significant value to the rural areas of eastern North Carolina. Funds are dispersed via grants and often directly to healthcare providers. So in my opinion, and I think that the Ryan White CARE Act does promote health promotion for HIV sufferers or victims or individuals with that diagnosis, and can be of use when trying to create programs and initiatives and outreach and surveillance when it comes to decreasing the incidence of HIV infections in North Carolina, Pitt County, and even the town of Greenville, North Carolina. I hope you learned a lot, because I did. Thank you for listening.